Hello, amazing listeners. Welcome to another episode of the Boob Business Podcast, the unscripted show where we unveil, demystify some of the confusing parts of birth, breastfeeding, and infant care during the first year of life while having a little fun. I'm your host, Naomi Catron, registered nurse and board-certified lactation consultant. Our mission here is simple: to foster collaboration in maternal-child health and empower both families and businesses alike. We're all about creating a community where everyone feels supported and informed. In each episode, we dive deep into engaging discussions that span the entire spectrum of birth through the first year. From newborn feeding, because let's face it, it's something we all have got questions about, to tackling issues like tongue ties, the mysteries of pacifiers, mental health, body work, and just so much more. So whether you're a new parent navigating the incredible journey of early parenthood or a seasoned professional in the birth business, this podcast is your go-to source for laughter, knowledge, and some great insights. So we're here to make learning about boob business not just informative, but enjoyable. So join us for conversations that not only spark your curiosity, but also bring a smile to your face. So remember, every episode is a chance to connect, learn, and share. So hit the subscribe button and let's embark on this exciting journey together. Hey y'all, so today's episode is going to be all about nipple pain and milk supply because I haven't done home visits in a while. I'm so blessed to have a really amazing team and a team of 4 other consultants who do a lot of the home visits, and I might do a couple office visits here and there. And then one day a week, I see patients all day long helping evaluate for tongue and lip tie assessments and if a surgical procedure is necessary with a pediatric dentist in town. And then a couple of the other days, I have other administrative tasks and operational tasks. And then we have a chiropractic business that I help with also. But recently, I have gone back into the field 2 days a week and I'm seeing patients in their home and I'm being reminded of the common things that come up that I forget are just common kind of like misnomers or things that maybe people don't realize. And so nipple pain and milk supply are like really common questions and concerns that people have. So one of my first visits was for a mom who's making 128 ounces of milk per 24 hours. And her baby was 5 months old at this point, and this is her first time seeing a lactation consultant. She didn't complain of any nipple pain or anything. Not yet. I think when you're pumping, well, if I'm not mistaken, she's breastfeeding and pumping. And I really can't remember all the details right now. The point of this story is that she had a lot of wear and tear. I say that your nipples are like tires. You have but so much mileage on them. And when I say mileage, I don't mean baby latching. I mean when you're having pumps and other artificial stimulation to your breast. And that can cause a lot of wear and tear on the skin. And in this patient's case, she was using a pump that I don't necessarily recommend at a high setting. And so her nipples just had become desensitized. They just were not going to hurt no matter what you did because it was so used to 5 months of being pulled on and stretched and whatnot. But once upon a time, I think early in the days, she had some nipple pain. And she heard of a product that many of you have probably heard about. I'm not going to name it by name. And if you haven't heard about it, you will. But it is a silver, like a little almost silver nipple covering that is advertised to be healing because it's made from silver for nipple pain. And so a lot of people I'll see with these silver cups over their nipples under their bra because they had nipple pain and someone told them that would help heal their nipple pain. And that's a miracle and it worked for me and that's great. And this is a good example of when maybe it's not always appropriate to listen to the advice you get on TikTok or Instagram. Because the question I always have whenever something's wrong with your body is, why is that happening? As opposed to just putting a Band-Aid approach to managing something like a silver cup over your nipple, we're not figuring out why that nipple pain happened. And so this woman had been using those silver covers over her nipples for 5 months. And so there was a thick white coating over both of her nipples, which I'll share a picture of like right here. Hopefully my editor can put it in here. And so if you're listening to this, you'll have to watch the video on YouTube to see the pictures that I'm about to show you. So this was a thick film of basically just like milk residue. I tried to rub it off with a little cloth. It wouldn't come off. But by the time I saw her 2 weeks later and she stopped using these silver covers, her nipples were perfectly fine. This is the problem with using something like this. Ask yourself, where does bacteria and mold and yeast like to live and grow? What kind of an environment? A dark, wet, warm, sugary environment. So when you cover your nipples that are leaking a little bit of milk drops here and there in a non-porous surface, so a surface that does not let your skin breathe, one of the negative things that can happen after long-term use is that you start to develop either yeast or a bacteria or mold because your nipple is being not allowed to breathe because your skin needs air. So it's under this little metal cap with milk in there. So it's a warm, dark, moist, sugary environment because breast milk has a lot of sugar. So you're just kind of asking for bacteria to grow and make a home there on your skin. We don't want that. The other reason I don't necessarily recommend you using this product for more than 48 hours at a time, firstly, because you're not figuring out what the root cause of the problem is, because nipple pain has to be caused by either, something going on with your baby's latch, which you may not be able to fix on your own. It might not just be like, oh, he needs a deeper latch or needs to open his mouth wider. There might be something else going on, but we don't know. We have to check it out. So it usually comes from inside of your baby's mouth with their latch, or pain is being caused because of a mechanical device, like the way you're using a pump. So we have to figure that out first. And you need a professional to get in there and figure it out. It's like taking your car to the mechanic to figure out what is going on when you hear a weird clicking noise. You usually can't figure that out on your own. The other reason I don't like using these silver covers for more than 48 hours at a time is because think about it if you keep your finger dipped in a little bit of water, or if you put a Band-Aid around, like, let's say you have a cut on your finger and you put a Band-Aid here, let's say, and then you go take a shower and you come out, a little moisture gets under there. Leave that Band-Aid on for 4 or 5 days. It's going to get smelly in there. It's going to get really wet, and like your skin even gets more sensitive. That's called maceration. That is when the liquid from the external world is sitting on your skin or something, and now it's starting to soak into the skin, making that part of the skin much softer, much more fragile, much more at risk for breakdown. Those of you who cook, the word maceration we will use when you want to, like, let's use strawberry. Like, let's say you put some strawberries in a bowl, they're clean, they're cut, or blueberries. You cover them with sugar, and what does that do? It draws out the water from the fruit, and then it makes a syrup. So you have your blueberries and like a syrup that just came from the inside of the blueberry, or strawberries. Once you leave them with sugar for a half hour or whatever, they have a little syrup. And so go ahead and try that at home if you have never tried it. It's a good way to make berries to go over your pancakes. But for your skin, we don't want that kind of fluid and that moisture leaving the breast, or the nipple even sitting in a puddle of moisture coming maybe from breast milk droplets that are coming out, because it makes the skin much more susceptible to wounds and damage, and the skin becomes much softer than it was before, and it can damage much easier. It's much more tender. Never mind leaving it in a warm, dark, sugary environment for a while. You're asking for weird things to grow in there. So please, 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 please don't do that. Instead, you might consider listening to episode, let me see which episode it was. It was with, episode 38, Triple Nipple Ointment Exposed, Dispelling Misinformation, with Dr. Katrina Mitchell, she is one of the members of the Academy of Breastfeeding Medicine and one of the authors of the new, I think 2022 mastitis protocol. And so if you want to learn a little bit more about what you should and shouldn't use when it comes to wound management for nipples, episode 38 can talk to you a little bit more about that. Just know that the answer is not triple nipple ointment usually. But the cool part about nipples and breasts is that they're highly, highly vascular. So they get lots of blood circulation in there. So that means wounds should heal very quickly if you're doing the right things and not re-injuring them. So a lot of times in our practice, a really good nipple ointment, maybe a little, I like to use Medi Honey when the wound is bad. And then maybe a little cover, like maybe a hydrogel or something called, Polymem. And 24 hours of nipple rest, like nothing else causing it damage or abrasion, like figuring out either how to improve that latch, how to improve the pump situation so you're in the right fitting flange and it's not causing you damage, or maybe the settings of the pump are way too aggressive. Figuring that out, coupled with really good wound care, meaning no dark, warm, wet places, 24 to 48 hours, your nipples should be back to totally on their way to healing. And if they're not, then you need to see a doctor about that and see if there's not an active infection or something, or contact dermatitis. But all those words should just say nipples should heal quickly, period. If you're having recurrent injury, you really need to see a professional. There's just no other way around it. If you had anything in your body that was constantly if you go get a pedicure and you keep getting like a ulcer on the side of your toe, you gonna keep doing the same thing, expecting a different result? I don't think you would. So just be kind to your nipples and just know, like, hey, if you're getting damage on your nipples and what you're doing isn't working after a couple of days and it's re-injured, we got to get a professional in there. You can't YouTube that away. You can't figure it out on TikTok, because a lot of these recommendations and tools and tips and tricks can cause new issues. Like I'm telling you about these silver nipple covers. So I'm gonna get off the silver nipple cover kind of a thing, and talk a little bit more about other things that can cause nipple pain. So one of the things I see a lot is improper pump use. And so starting with just a pump itself, there's lots of different pumps on the market, and they all promise you everything, like the world. Like they all say they're the best at this and they're hospital grade and all of that. When I was in the hospital with my baby, I wasn't a nurse. I didn't know anything about anything, nothing. I didn't even know how to change a diaper. So I was like, how do I pick a pediatrician? They're asking me how I should, they're telling me I need to pick a pediatrician before my baby leaves the hospital. And this baby I had was in the NICU unit. So I was like, I don't know how to pick a pediatrician. And someone said, you know what, you might want to ask the NICU nurses. They know a lot of doctors and they know who's good on and off, behind the stage and they know what's happening behind the scenes. And so I picked a pediatrician based on what the NICU nurses recommended, and they were spot on because they know what's happening when things get, a little heavy. They know how the doctors are responding. They also have lots of experience working with these people. Why am I bringing this up? Well, how do you pick a pump based on some advertising? It's all not truthful. So ask someone who uses a lot of pumps, like a lactation consultant. So that's something that you should be covering in your prenatal lactation consultation. And these are a lot of the things that I do talk about in my book called Milked, Finding Your Flow in the First Weeks of Breastfeeding. These are all the things people, how could you possibly know everything? You cannot know everything, but a prenatal consult is very important. One of which is when do I start pumping? Do I need to pump right away? What pump should I be getting? Should I get one of those hands-free pumps that promises me this, that, and the other? And your lactation consultant, because this is all that we do over and over again, just like those NICU nurses know that these doctors do treat babies all day long, and they know who's treating them in evidence-based, way, and they're really good at their jobs because they do it all the time. They know which ones to refer you to. The same thing with us. Like, we know what pumps work for different situations. What you should know firstly is that hands-free pumps are not the pump that you want to get as your primary pump. So not the pump you're going to be using the first few weeks in life, not the pump you're going to be using more than on occasion. So hands-free pump, generally speaking, for a first-time mom, are not going to be your go-to pump. Hands-free pumps might be appropriate after 3 months of life on occasion, in the airport, on your commute to work. That'll probably be about it, unless you have a robust milk supply and don't struggle with mastitis or plug ducts or anything, and we're able to find you a pump that your body responds to the same way it does a primary pump. So you might ask, well, what is a primary pump? A primary pump is going to be a double electric pump that you plug in, right? So that's super important. I have a bunch of pumps in my office, but we did a whole podcast episode on this. So if you want to see like what I'm talking about in more detail, go ahead and reference episode 4. You're going to probably want to watch the YouTube version also, because we're looking at flanges and looking at breasts and we're looking at how it works. So choosing the right pump, want to get a primary pump as your first pump. So when you're calling your insurance company, I'm not going to name brands, but you want to take our prenatal class and learn what brands we recommend. But you're going to want to get a double electric pump. And you're going to want to get the flanges that look like shields, like they're like little, like looks like a cone, and it has bottles connected to it. And that's going to be your primary pump. Now, what you may not realize, and I love Jeanette who was on that episode on episode 40, she created this document that our patients do get when they become our patients, and it does show you here, like, what's too big. Like, this is too big of a picture here. This one right here. This is where the flange is allowing areola to come in. And you're going to have pain and abrasion and friction there. And that can cause some nipple pain and nipple damage. The next picture is a little bit better, but it still is letting some areola come in. The third picture, no areola is coming in. It's just a nipple, and it's just gliding against the inside of the pump flange. And that is what we want. This is newer information. So you may have been told in the past to add, 2 millimeters to the whatever you're sized with. But that is what we realize not going to be the most comfortable or effective size for you. You probably won't get as much milk out if we get one that's comfortable, but that your nipple does glide gently in and out. We just don't want any areola coming in and out of that flange. So people who are pumping cause themselves nipple damage. People who are pumping with the wrong pump cause themselves to have mastitis. Do you know how much it costs to go to the hospital for mastitis? Just think about it. Like, it's a lot of money, okay? Anytime you go to the hospital for anything. How much money does it cost to have a lactation consultation? Probably less than your deductible to go to the hospital for mastitis. Now, not everyone has to go to the hospital for mastitis, but I can tell you people do go to the hospital for mastitis. The heartache that mastitis causes, from low milk supply to feeling like you have the flu, to the time and the effort it takes to work your milk supply back up after having mastitis, to the milk you lost while you were sick having mastitis. An ounce of prevention is worth, a gallon of milk is all I can say when it comes to that. So while mastitis itself is not nipple pain, like that's not what it is, a person who has mastitis or has gotten mastitis, sometimes, they are getting nipple pain first because of improper pump usage. And then maybe they get breast pain or clogged ducts because of the pumps not removing the milk efficiently. And all I can tell you is I see a lot of damage to people's breasts and nipples because of the pumps that they are using, maybe at the wrong settings, maybe the wrong kind of pump, maybe the wrong kind of flange. And so it's really challenging just to get a little measuring tool and just measure the tip of your nipple and think that's it, because that is not it. There's a lot more that goes into it. So I just want to put that out there. The only example I can give you from real life, and I'm not sure how many people would know this, but I used to road cycle a lot. I don't anymore. But when I got my road bike, I was told, listen, people just think you just push the seat up and down and you find what's comfortable and you get on your bike and you go that way. That might be okay if you're getting on your bike once a month and you're going like 2 miles and that's it. You probably will be fine. But I wasn't doing that. I was going 25 miles at least every weekend. And I was told you want to go to a bike shop and they use special tools to fit you to make sure your hip and your knee and your torso and all that are measured properly, because if you're doing a lot of mileage, you can hurt your back, your knees, and your pelvis if you're not properly fitted. And thank the Lord I did that. It has been more than 10 years using the same bike, same fitting, never had knee, shoulder, hip or anything like that because of it. So just know the same thing is with your breasts. Like your breasts, people don't realize this. Your breasts are glands. They're not a muscle. People think like I have chest muscles. You do. You have chest muscles behind the milk-making glands. So any gland that you have in your body, you don't go roughhousing with it. You don't mush it and press it and mash it and put things on it to apply pressure to suction the hell out of it. You want to be nice to it. And because it's a gland, a milk-making gland that your baby needs to survive, you want to get a specialist in there to properly fit you and make sure all the things are working well. Not every lactation consultant is good at that. I mean, you want to find someone who's been trained in doing it. Generally speak, we have lots of different pumps in our office. We have all the different size flanges and shapes and all that. And that's what you want to look for in someone who's helping you through this journey. But don't mess with it at home. Don't try to just piecemeal it together at home. It's just not worth the room for error there is. Okay, so I talked about the silver things that I don't love. I talked about pumps and flanges that cause some nipple pain. Of course, your baby's mouth can cause nipple pain. Of course, if your baby's all tense like this and trying to latch like in this position, chin into the chest, that can cause some nipple pain. So, we need some professional help to work on that. But let's talk a little bit about milk supply. I told you in the beginning that I had a patient who was making 128 ounces per 24 hours. I'm trying to remember. I don't know how the whole thing started because by the time she came to me, she was more than 5 months postpartum. I believe in the beginning, she had some milk supply issues or jaundice or something with her baby. And they just people in the hospital told her to pump after she nursed her baby and she just never stopped. And then she kept getting engorged. So she just kept removing the milk. And then she thought she had to have a lot of milk stored in her freezer to go back to work. So she was just kept pumping. And then for 5 months, she's like, I'm really tired of all this pumping. How can I reduce pumping? Because I have enough milk now for the whole next 6 months of my baby's life. So thankfully, the interventions that we did brought her from 128 ounces of milk. Within 2 weeks, she was down to 81 ounces of milk per day. And we're just going to keep trucking forward. She had gotten mastitis. That's what was a lot. So she was making 128 ounces after she got mastitis. So I don't even know how much she was making before then. So she came to me because she got mastitis and she's like, okay, this is a little bit of a wake-up call for me that maybe I'm making too much milk. Can you help me reduce my milk supply? So that's what some people think they want. They want to have that much milk. But the first thing I want to tell everyone is that oversupply is probably the most difficult thing for a mom to manage and a baby to manage. So when you have oversupply, many times those babies are extremely gassy and have extreme reflux and are very fussy because they are being waterboarded all the time and they have a lot of digestive issues. Moms who have oversupply generally suffer from recurrent plug ducts, which are not comfortable. They feel like little bruises all over your breasts and there's lumps always there. And sometimes you are engorged a couple of times a day. So your breasts feel hard and tender and hot and they feel like they're going to pop and uncomfortable and you can't lay on your tummy and you can't wear normal clothes. But more importantly, you have all this milk that you're like, what am I supposed to do with all this milk? And then people will sometimes stick it in their freezer, not realizing in some people their milk will change flavor. It's called high lipase. So you would have to test your milk first, pump some milk freshly, and take an ounce or two and like taste it, smell it, put it in the freezer, thaw it, taste it, smell it. If it has a stark, metallic or soapy flavor, it's going to be very obvious that you can smell, pretty quickly, or taste. It's a total different taste than before it went into the freezer. That means you have high lipase, and you don't want to start feeding your freezer because the likelihood that your baby's going to be willing to drink that milk is not very high. And so you're going to really want to be careful and work with a consultant to figure out a plan before you start feeding your freezer, and then thaw it and find out there's all this milk that no one's going to drink. The other thing I see a lot is that people will lose power in their, they'll lose power, and then they lose this milk that's in their freezer, when really, as long as you just keep your boobs happy, you're not going to run out of milk. So if we just keep you, your mom, yourself, the mom happy, nutrition, hydration, keep the breasts, remove milk frequently and effectively. When I shouldn't say frequently, I should say, 6 to 8 times a day, depending how old your baby is, you're going to be trucking along just fine. 6, 8, 10 months, you'll be fine. Okay, so oversupply is not a blessing. It is many times a curse. Much higher risk for clogged ducts, recurrent clogged ducts, and mastitis, and gassy baby, and digestive issues. So there's that. Let's not pray for an oversupply. But I understand when you have low milk supply, how stressful that can be. So I want to talk about some of the things you can do. And you know what? I have a whole section in my book on this. Let me go grab a copy of the book. Okay, I'm back. So there's a whole section on ways to increase milk supply in here. This book is made in, kind of to help people in the first few weeks of life. So this is not what you need to do at 5 months old. This is kind of what you need to do in the first few weeks of life, because setting your milk volume, like being sure that it's really fuzzy in the camera. There you go. Being sure that we set our bodies up to make proper milk supply starts right after birth. And so one of the things you can do to help make your body primed for long-term milk supply, appropriate milk supply, is we want to frequently and effectively remove milk and colostrum from the breasts starting the first hour after birth. So a lot of the times in the first few days, that means learning how to hand express, which I talk about all in the book. I give you resources, a bunch of free resources and videos. But sometimes your baby might be a little too sleepy to fully latch and remove the colostrum. If your baby is able to do that, amen, more power to you. Please keep latching your baby. Keep listening for those swallow sounds and the jaw motions like they're swallowing. And let's have them at the breast, 8, 10, 12 times a day in the first 72 hours. And that is going to be a fantastic way to boost your little brain, to tell your body, yep, make some more of those milk making hormones, because she's removing everything I'm making. So I got to make some more to keep up with her. However, there's a multitude of things that can happen. Your baby, you could have gotten magnesium in your labor because you had preeclampsia, and your baby comes out really sleepy, and then they don't want to nurse that much because they're too sleepy. Hey, there's other tools that can help you protect your milk supply. Hand expression is one of the main ones. What if your baby has to go to the NIC unit and isn't near you to latch and remove milk effectively? How are you going to prepare yourself for that? We can't just go to sleep for 8 hours and then go visit the baby in the NIC unit and then put the baby on you after 8 hours of birth and then try to get them to latch, and then maybe they latch for 2 minutes and then they fall asleep, and then you do it again 4 hours later. That's not going to work. That's not going to help your body have a full milk supply. I shouldn't say that's not going to work. That's not ideal. Anything is possible. Some people can have high milk supply and not do anything but just look at a baby. That's just not common. So there's also just, like I said, what if your baby comes out 34 weeks, 36 weeks, 37 weeks? A lot of the times those babies don't have the stamina to nurse, to breastfeed, and effectively remove milk, because that's what this is all about. And if you want to learn more about that, listen to episode 22, which is called Feeding Your Tiny Fighter, Understanding the Unique Needs of Feeding Preterm Babies. And it really should say feeding late preterm babies. So any baby that's born less than 38 weeks, like this is the episode you're going to want to listen to. So lots of reasons that a baby may not be able to effectively and frequently remove milk at the breast, because that's the number one thing you can do to increase milk supply is within the first hour or two after birth, we want to frequently and effectively remove the colostrum from the breast. So that would be about 10 times in that first 24-hour period, 10 times the next day. And that's going to be really helpful to get all the hormones in place to help transition your milk from colostrum to more mature milk that it's going to be coming out, not just in drops, but it'll be coming out in ounces by the time you hit 5, 6, 7 days, depending on your birth, depending how old your baby's birth was, or how old your baby was when he was born. Like if it was a 28-weeker, your milk supply might be delayed a little bit. But if it was a 42-weeker, you might just be primed and ready to go on day 3. The other thing that's very important, which is something a little bit out of your control, we want to make sure your placenta is fully out of your body, because the placenta being born is going to be one of the most important things to tell your body to go ahead and make more prolactin. Of course, you're not in charge of really the placenta part. Your baby comes out, you're super excited. You might not realize you have to push one more time to get a placenta out. You know, you might want to ask your obstetrician, hey, any chance there could be anything like retained placenta? If the placenta should come out in one whole round piece, looking like I have no idea what to compare it to, but maybe like a bluish, purplish, jello mold with veins in it. I'm sorry, I don't have a good example. You guys should email me and give me some better examples. But it should be one whole piece. If you're like 2 weeks, 3 weeks postpartum and your bleeding is not getting lighter and you're passing clots the size of an egg and you have bright red bleeding and you have low milk supply, you're going to need to talk to your obstetrician or your midwife and ask them, hey, is there any chance that I could have retained placenta because I'm having bright red bleeding? My bleeding is heavy. It is not getting lighter and it is bright red, not getting brown or spotting is still heavy. So those are some signs. Those are 2 really, really big things that you can do and be aware of in that first 2 weeks of life or so to help really maximize milk supply. Now, your baby does not need to be or should not be needing to eat 10 times a day forever, but that first week or 2 of life, yes, frequent and effective milk removals is very important. Also, this is going to be controversial. I might get a lot of hate email. I don't really care. I'm going to tell you the truth. Don't start training your baby to sleep long times. Like, don't do sleep training at 6 weeks old. Like, that's going to kill your milk supply. So babies sleeping for 8, 10, 12 hours overnight at 6 to 8 weeks of life is not the physiological norm. And that can absolutely lower your milk supply if you're not removing milk during that 8, 9, 10 hour period so early in their life. Now, if this your baby's 5 months old, even maybe 4 months old, and he's sleeping 8 hours, depending on your individual milk making history, that might be appropriate, but you need to talk to your lactation consultant about that. So those are a couple of the things I find that people don't realize can impact their milk supply negatively. I started off talking about how difficult it can be to have an oversupply, because what I don't want people doing is getting a nice, robust milk supply. Breastfed babies, generally, a full milk supply for them is between 25 and 30 ounces per 24 hours. So what I don't want is for you to arrive there and then be like, I want to have extra because it makes me feel better and more secure. And then you figure out a way to get your body to make, instead of 25 ounces per day, now you're making 40 or 45 ounces per day. You're going to start hating life. And that is just not trusting your body to provide for your baby. And you're feeding your freezer when you really don't need to. When you return to work, I know people will like, well, I don't want to have milk when I return to work. What I want you to understand really in real life, worst case scenario is all you need is 1 day's milk before you go to work. So like you just have, let's say you're going to be gone from your baby for 10 hours. You might need 3-ounce bottles. That's all you need while you're gone. Because when you go to work that day, you're going to pump 3 times to replace those bottles. So she would have 3-ounce bottles that you'll send her to school with or leave her home with the dad or with whoever, grandma. Just 3. If it's for an 8 or 9 hour period, right? And then, am I doing my math right? Around every 3 hours, 3 ounces, 3 times 3 is 9 hours. Yeah, or, let's pretend it's 4. Just so you got 4 3-ounce bottles, just to be extra sure. Like say you get stuck in traffic. That's it. It's 4 feedings. That's it. So really, you can just harvest 1 bottle a day for the week, like 4 days before you go to work. Like 1 bottle on Wednesday, 1 on Thursday, 1 on Friday, 1 on Saturday, 1 on Sunday. That's even 5. If you go to work on Monday and you have all 5 of them bottles that she can drink in that 1 day, and while you're at work, you are going to pump and replace all the bottles that you gave her on Monday. Now you have that for Tuesday to give her, and you're always just 1 day ahead. So people are really freaked out about having all this milk when they go back to work. But just remember, your breasts are not going to cease to stop working. They're still making milk the whole time you're at work. So that's enough about that. Just know that an oversupply can be just as difficult and take the joy out of breastfeeding just as much as having a low milk supply. Now, there are medical issues that a person could have to cause a low milk supply. And what I want you to hear me say, which I've said in several times, over the last couple of years of this podcast, is I was a person who had low milk supply. And there are reasons for that. And it's sad and it's difficult. It's very hard to diagnose. But there is a small part of our population that will have chronic low milk supply for no reason, like nothing that they did. It's a very small percentage. Less than 5%. But what I don't want you to do is triple feed. So breastfeed, bottle feed, then pump for months and months at a time. That is not a good quality of life. That is not joyful. That is not adding to your relationship with your baby. And that's not going to help you all of a sudden make milk. So if your body is not responding to the milk making plan that maybe you and your consultant have come up with, your body should respond within a week or 2. So if it is not responding, we might start to think like, hey, maybe there's something else going on here. But I just don't ever want to see a mom triple feeding for 3 months, because we're not doing anything but taking away from your quality of life if you're not actually getting more milk. So when you do an intervention, let's pretend we're trying to get fit and we want to get something, maybe our cholesterol down, and you try a diet and then you get your cholesterol taken and your cholesterol didn't change. You're not going to keep doing the same diet because it didn't change your cholesterol. You're going to change your diet until you find your diet that helps get that lab result the way you want it. Same thing. We're not going to keep triple feeding if we're not getting more milk at the end of the day. We have to figure something else out. Sometimes there's another plan, sometimes there's not. We don't have a magic wand to fix things if you have maybe a condition called insufficient glandular tissue, or if you have some sort of hormone issue that is impeding on milk making capacity. But I don't want you to waste your time doing something if it's not getting you the results that you want. But those of us who are, maybe still pregnant, or maybe we're a doula supporting a mom, maybe we are an obstetrician, or a pediatrician, I would just say, please encourage each of your clients to get a individualized assessment and help, because it's not a one-size-fits-all approach. So telling someone, don't pump, it can cause an oversupply, may not be appropriate. That mom might need to pump. Or telling someone, I don't know, never use a hands-free pump, that may or may not be appropriate for them. Or telling someone, to pump after every feed, that may or may not be appropriate. There's no way to know until someone is actually following you. We're, a couple weeks, making sure we're checking in, seeing if we're getting to the results that we want. Most importantly, above all, please prepare for feeding your baby. Please do not think it's just magically going to happen. And that is, the whole premise for this book. It does not need to be. I don't want any of my listeners to leave the hospital or their home birth and be like, uh-oh, now what? Like, this is not what I planned. This is not what the textbooks say. This is not what my prenatal breastfeeding class said. Things are a little bit different. I'm not sure he's getting enough. He's really sleepy. I'm not sure I have enough milk supply. So I'm going to go on TikTok and figure this out and then cause myself another problem. So nipple pain and milk supply issues are two of the most common. However, the way to overcome and navigate the solution to those two ailments, if you will, there's like 10 different ways to manage nipple pain, depending what's going on. At least there's like 10 different ways to address milk supply, depending what's going on. Mixing that up, you can have 100 different combinations, and what is the right combination for your situation is very unique and takes more than just a couple of TikTok or YouTube videos to figure out. So that's my little plug for today. I hope this helps you guys. Go ahead and check out those other episodes that I mentioned in this podcast. And don't put those silver things over your nipples for weeks on end, thinking it's going to just magically keep your nipples happy forever, because you might accidentally be shooting yourself in the foot. All right. I hope this helps you guys. Check out our webpage if you're interested in learning a little bit more about the book and getting some of those free bonuses. You can go to milkd, like the letter D, book.com, and that's where you can learn more. Okay, I will talk with you guys later next time. Bye. Thanks for listening. To learn more about newborn feeding and get your free swipe file, visit milkdiva.com/newborn feeding. And if you've ever said, wow, I wish I would have known that while you're listening to this podcast, then help a friend out and share this podcast with them. You can also help us by leaving us a rating so more people can benefit from finding this podcast. Medical disclaimer. Please know that all opinions expressed on this podcast are solely my own and not intended to substitute the advice of a medical provider. I am not a medical doctor, and all information shared is intended for your general knowledge and is geared towards full-term, healthy singleton infants and healthy, low-risk pregnant or postpartum women.